Okay, and what they all do, what they all have in common, is they eat through that stomach, or they diminish the stomach lining that's protective. So then the acid, hydrochloric acid, can just eat right into the actual tissue and cause an ulcer. Okay, this is chronic NSAID use. This isn't going to happen if you're taking an occasional Motrin or something every week or two. Okay, this is going to happen if you're chronically using it. Okay. Yes.
Can you repeat what NSAIDs means?
Non-steroidal anti-inflammatory drugs. It's basically everything that kills pain except acetaminophen. I mean, really, as far as all of those over-the-counter kind of things, when in doubt, probably is, except for Tylenol. Okay, that doesn't actually do anything for inflammation, it's just for pain. Okay, but it also doesn't eat away your stomach line. It does kill your liver. That's why I actually went to London, because everybody used to say that, you know, you can't buy Tylenol in London or in Europe. So yeah, I went to London like 3 years ago, and I went to a pharmacy. And yeah, that's true. You gotta have a prescription to buy Tylenol there, because people are like eating it like Tic Tacs, and it kills your liver if you eat that much of it. Anyway, I digress. This H. pylori thing, you know what that means? What that stands for, H. pylori? What it is? What? Garrett, you moved. I heard Garrett's voice, I'm looking there. Yeah, H. pylori. You can go back for pylori is a bacteria. I guess technically it's a bacterium. And they have been saying for many, many, many years that H. pylori will cause an ulcer. Okay. I don't know, Dr. Cooper showed me an article a few years ago, actually. They are challenging that now. They're not positive if it actually does or not. It might be a correlational thing instead of a causation thing. But either way, right now it's still considered a possibility. So you're going to see that. So you're going to see that in the all the time in hospitals. So you'll do like H. pylori tests for people that keep getting ulcers all the time. It's pretty easy. I mean, you can do blood, stool, breath. The breath one is, I think it's like a blue and a pink little bag, and you blow in them, and then you seal it off, and then the lab goes ahead and measures the amount of bacteria in there.
So if they're giving them, because normally you want to kill bacteria with an antibiotic.
Uh-huh.
And so that would just disrupt everything.
What do you mean?
Well, it would kill the bacteria, but I mean, it would disrupt like your flora, your healthy flora.
Well, yeah, all antibiotics do that. That's why you don't want to give antibiotics unless you have to.
Mm-hmm.
But I mean, again, if somebody's having chronic ulcers, it's what they're for. You know, you give them an antibacterial, give them an antibiotic, and hopefully it fixes it.
And you have to also consider that one is living in your stomach.
Yeah.
So it's an extreme kind of type of bacteria where it can deal with acidic environments. And you'll get into that as well in micro. You'll mention it too, like those extreme bacterium that can be in extreme areas.
Okay. So, what does hemoptysis mean? Hemoptysis. Hemo meaning blood. Tysis meaning cough, right? You're coughing up blood. Okay? So again, if you have a bad enough ulcer, a bleeding ulcer, then you can cough up blood. Okay? Melena or melena, heard it both ways. Black tarry feces. Why would you have black tarry feces?
The bilirubin.
It's what the blood looks like when it gets all the way through the system. Yeah. ETOH is ethanol or ethyl alcohol. It's just faster to write alcohol. Not much, but something about the way you write it is faster. So everybody does that. ETOH. It's somehow faster writing the word alcohol. I guess the way the fingers move or something, because everybody always writes it. Okay? Questions? Any more peptic ulcers stories? Okay. All right, so Ellie, 55-year-old female, presents with a need to urinate frequently and has pain while she does. Do we need to read any further? What's she have? Probably has a UTI, urinary tract infection. However, let's keep going. She also complains of lower back pain and persistent abdominal discomfort. Lower back pain, start thinking kidneys if there's a UTI involved, right? Ellie has come to find herself easily confused lately and has a known history of diabetes mellitus, which is controlled through medication. Not a good sign. After examination, all vitals came back within normal ranges. However, a urine sample comes back positive for nitrates, hematuria, and bacteria. Likely cause of these symptoms. You guys already said a UTI, right? Okay, now if you look at this, threw a couple of things in here. Frequent urination, pain, that pretty much says UTI, okay? The back pain, again, the lower back pain, probably kidney involvement. It's no longer just a UTI at that point if it's involving the kidneys, something maybe like pyelonephritis, which can get out of hand pretty fast, by the way, once it hits the kidneys. Confused lately. Why would she be confused? Jesse?
Because of the disruption in the ion, right?
Because of who? The electrolyte imbalance? Does she have an electrolyte imbalance? Why does she have an electrolyte
Well,
imbalance?
she's not peeing it out. She's keeping it in.
Oh, okay. Yeah, she could absolutely have electrolyte imbalance because her kidneys are messed up, right?
But she's
Sure.
more in acidosis.
She's probably in an acidotic state. Okay. Because of that, that means the brain is also in an acidotic state. Okay. Here's one of the big warnings or lessons from something like that. Ellie is 55 years old. What are the odds she has Alzheimer's?
Well, I mean,
She's like very possible.
it's like early.
That would be really early Alzheimer's, like really, really early. Okay? If she was 85 years old and in a nursing home and you had the same scenario, did you know the #1 cause of dementia in the elderly is actually urinary tract infections for that reason, with the whole acidosis? Okay, not everybody gets Alzheimer's. That's not a normal cause.
Is it dementia or delirium?
Well, okay, technically it's delirium, and people think it's dementia. Thank you for that. Yeah, technically the #1 cause of delirium in the elderly is the urinary tract infection, especially females, because they got that little short urethra. Okay? But you could literally have the same exact thing, throw 30 years on this person, and people are going to be like, oh, she just has dementia. No, she has delirium from an infection that's affecting her brain.
At that point, can you fix it?
Yeah, of course. Yeah, you just, again, treat the urinary tract infection, they're fine. Unless, of course, you think that they have Alzheimer's dementia and don't treat it. And then you just really screwed somebody up, right? Now, they may be willing to die anyway, but that's beside the point. Okay? Oh, trust me, you'll see. It's frustrating when you get elderly people and you're working with them and they're like, no, just let me die. You're like, but we can fix this. They're like, no, I'm good. It's frustrating, but it happens a lot. Well, you can't do something against their will, no.
You can send them to Oregon.
You should send them to Oregon again. Okay?
Right to life.
So, hematuria, okay, bleeding in the urine. There are a lot of different reasons. Again, that case was probably more like pyelonephritis because it went back into the kidneys. You can have all sorts of issues with the kidneys. Benign prostatic hyperplasia, obviously only in males because females don't have a prostate. Okay. Trauma, of course, you get kidney punched or something. Duh. Some medicines, right? These things that thin your blood out, okay, will cause that. Penicillin has a sometimes side effect of having people bleed in the urine. You're gonna have to tell me if this is you. Strenuous exercise causing you to have blood in your urine?
No.
Are you out there?
Tell us your experience.
Strenuous exercise causing you to bleed into the urine. Whoever you are, you're working out too hard, stop. Okay? That's just crazy. We're talking like extremely competitive kind of stuff.
Physiology-wise, like what happens is that blood gets in there out.
From all the proteins.
It could be, yeah, it could be. There's a bunch of reasons, yeah. So say you're just slamming protein. Proteins are big. They're gonna be slamming against that glomerulus all the time. If you're like an ultra marathoner, triathlete, when you actually are exercising in that fight or flight mode, it actually does turn off your filtering system, and that means it also is lowering your blood flow through there. That's why triathletes, they are in danger, especially if they're taking something like ibuprofen, which constricts anyway, vasoconstricts anyway, that afferent arterial. Then yeah, you can actually cause damage to your kidney, and you can end up urinating blood because you hurt your kidneys because you're exercising for a very long time and you're adding on vasoconstriction in the mix, so that does happen. Okay. We are coming up on Thanksgiving in another month and a half or so.
Yay!
If you happen to be out in the hospital, keep in mind when the mom drags a little kid in, said that they are bleeding in the urine, make sure you ask, well, did they have beets, rhubarb pie, berry pie, cranberry sauce, all this red stuff? Yeah, that happens around Thanksgiving every year, right? You ate a whole lot of red stuff yesterday. Of course it's coming out in the urine.
Can
right?
a group strep infection cause you to urinate blood?
Strep?
Yeah.
Yeah, okay. Here's the thing about post-streptococcal glomerular nephritis, okay? This is kind of a big deal because, actually let's take a quick survey here. How many of you guys, raise your hand high if you've ever had strep throat? Okay, look around. That's like almost everybody here. Okay? No, keep your hand up. Keep your hand up. If you've had strep throat more than once, keep your hand up. Okay, we put their hand down. If you had strep throat more than twice, keep your hand up. Okay, we're having like one person put their hand down each time. You can put them down because you get the point. People who are prone to strep infections keep getting strep infections. Apparently this entire row and myself never had one, never will. Okay? Those of you that get it are going to keep getting it. And
My son was hospitalized with strep, and his whole, he had this huge, I don't know, fluid inside.
massive.
Yeah, and it looked weird, but we were there for 2 weeks.
Yeah. Yes.
And they had to perform surgery to drain it.
To
and
drain it
everything.
out. Yes.
Pretty bad.
This is kind of off topic in a way, but when people get their tonsils taken out, why, if you have your appendix taken out, do they not want to take out tonsils?
Because the tonsils are a lymph organ, and so is the appendix. Despite what your anatomy book says, it is not a vestigial organ, it is a lymph organ. We know it has lymph tissue in it. If you take one out, you probably don't want to take the other one out because it's just, they both do something. That's why it keeps getting infected. It's because it is a lymph organ, just like her son had a lymph node probably infected because of strep. So they are actually doing something. Okay? Now the thing about streptococcus, as in strep throat, if you do not treat it, and a lot of people don't because they're like, oh, it's just another strep infection. Keep getting them over and over, right? Mm-hmm. If you don't treat that, you do run the risk of that going systemic, as in getting bacteremia throughout the entire bloodstream. If that happens, you could have your immune system catch up with it when it hits the kidneys, when it hits the glomerulus, and then you have this battle between your immune system and strep, and they leave shrapnel behind. They damage the kidneys. They cause what we call vegetations to be laying down.